I have both a topic today and I'm in a new home. We have been settling in and moving in and settling into our new home here in Reno, Nevada, and doing all the bureaucracies and all of the organizing and all of the figuring it outs that is a lot. It's part of the moving experience. So we have been split, just spending a lot of time doing all of the normal moving things on top of the other bureaucracies. As I think I've mentioned before, my partner is in the process of going through the green card process, and that is full of bureaucracies and lawyer meetings and paperwork. And so we're dealing with both at the same time. It's life. So we've been life in it. And as we've decided to settle in the US and live here and move and find a home and do all these things, the other thing that we have been working on is health insurance. So this is what I actually want to spend today's topic on.
Welcome! Here is your hostess and coach, Chandra Zas, helping people make food and mood changes doable without missing out. Go ahead, high five that like button, subscribe and share while you're there.
Is health insurance. So I want to give a bit of a back context to health insurance. I'm pretty sure I've never done a podcast or video on health insurance, even though it is definitely a topic that is very much in my heart and something that comes up with my clients a lot. And, health insurance is part of life. And honestly, like my partner and I, we did not plan to live in the US when we met 8 years ago. We were really looking globally where to live, which country to call home. And during that 8 years, I've lived in Israel for close to 3 years, cumulatively, maybe 3.5, and experienced like incredible healthcare there, where there's no questions, the costs are almost nothing. Labs, doctor access, it's like really feels like actual care for my human well-being. And I've always known that American health insurance is like not the best, but living out of the country and having other experiences made it even that more obvious of like how much our healthcare system is lacking. And it is honestly the biggest reason that I didn't want to live in the US was our health insurance. And the way that I've come to understand health insurance and the medical system in the US is basically like the way that our medical system was set up was it's set up as a for-profit business. And so the incentives of our medical system here in the US is profit driven. And unfortunately, healthy people are not profitable. People who need medications and who need procedures and surgeries are where the profit is. And so it's really hard to incentivize health and wellness. I know my sister-in-law actually works for Kaiser, and she has been telling me that a lot of Kaiser's new recent business development is actually more focused on wellness, which is so exciting to hear. And there is a lot of incredible alternative care that is here in the US, amazing doctors who really care and who really are focused on wellness and well-being. And it's not like the mainstream health care that most people have access to in the US. And being in California this last 6 months and seeing the homeless population rise in every place we went, along the freeways, it's like heartbreaking. And I know that one of the big factors of homelessness is health insurance, is going bankrupt and not being able to pay for medical bills. There is a loop here that is scary. It's really scary to think about having an emergency and being bankrupted because we can't pay for a health issue. It's real here in the US. So,
hello, my friend. How are you? I'm in the Dead Sea, floating in the water. Go ahead and like and share and follow so we can keep in touch.
As we've decided to live here, the health insurance has been one of the biggest struggles and battles for me internally, because as I look at the premiums of what to pay every month and I look at the coverage, I'm I'm really frustrated because I personally I do everything preventative for my health. As you, if you know anything about me, you know that I'm a health coach who's all about like living healthy, preventing disease, diet, stress, lifestyle, like really changing these factors and every day influencing these influencers that we can influence on our health. It makes all the difference. I mean, this is how I was able to get out of being not having my health and being a sick kid, was making these diet, stress, lifestyle changes, and then it's miraculously my health symptoms clear up, which my doctor at 15 told me that I was going to be on prescription medication my whole life. I have been medication free for over 20 years now, and 70% of Americans are on medications. So I and my family, all of my my immediate family is all medication free, and we're not the normal. The normal is to be on medications. So thinking about paying a premium and thinking about having one annual exam, which, wow, I did an annual exam last year here in the US, and it was like a joke. I couldn't believe, I couldn't believe it was like $300 for, it felt like really nothing. The restriction on labs that we're able to order here, it's based on profit. Like, we're not able to order labs that actually really show our full blood work, that show really what's going on in our body at the more acute phases. Instead of, it has to get to a really bad phase until we really get access to at least we get health insurance coverage for labs. You can pay it out of your pocket, of course, but actual like health coverage, it's minimal. And so thinking about I spend a lot of money, my family, we spend a lot of money on preventative health costs, and we think about it like investments. And so to pay for this health insurance that's basically like emergency health insurance, so we're basically trying to cover ourselves, like if somebody breaks a leg or if somebody gets has this health emergency, then we have coverage with a $7,000, $5,000, $10,000 deductible. It's just wow, it's really frustrating for me to see this health insurance system. And so I've been knowing that I had to we've been on traveler's insurance for the last 6 months, was the way that we could figure it out because of the gaps in the whole thing of even trying to get insurance was just so frustrating last spring, of realizing that you have to actually to fly into the country, and then it's another 6 weeks before I get coverage, and the whole way that our health system is even set up to even get health coverage. And then the short-term insurance and how expensive that is, and then what it doesn't cover. It's just my little one has a cold, and now I have a cold also. It's just not coverage. It's just not, you can tell that I'm emotional about this and obviously not thinking very clear. Health insurance is excuse me, it's it's a topic that is very emotional for me, as you can tell. So looking at what are these options that we have, I have just been feeling trapped in my heart and my chest, and thinking about what are we paying for, what are we getting, what are we not getting, and the actual coverage that we want to get. My goal this decade is to reverse my biological age, and I know that it's totally possible, with looking at genetics, with making tweaks to my lifestyle, change my food, stress, lifestyle, supplements. There's a way that we can actually reverse our biological age. Totally possible. If we have access to really getting the data on our bodies, to getting the data to what's going on our specific genes, what's going on in our blood work, but it requires money. Excuse me. I have a frog in my throat. I have a cold. I'm recovering from a cold. So, and I'm losing my train of thought. So I'm actually totally, what was I talking about? Health insurance, what's covered, what's not covered, and the brokenhearted turmoil that I'm looking at what the options are. Now, where I'm actually at, so 6 months I've been looking at different options, trying to figure it out. Our health, we need to figure out in the next week, less than a week, what our next coverage is going to be. And being on traveler's insurance, emergency insurance, has been interesting of its own. But what we have found, my partner, he's always suggesting, we always listen to health podcasts together when we're driving, and he found a podcast that was talking about this new alternative to health insurance, and it's called CrowdHealth. And we have started talking with them and seeing what their coverage actually looks like. And it's not health insurance, but it is a way to have access to health coverage and have bills be shared amongst a group. The idea is like it's decentralized, it's connected and built on the same kind of structure as Bitcoin. And the idea is that there's only a couple of like disclaimers, like you can't smoke and you can't be over 300 pounds. And you join, and it's $175 for adults, and kids I think are $225, and then over 65 I think it's $3 something. And you pay that per month, and then you have your wellness annual exams covered. And then per health event, you pay the first $500, and then the rest, the crowd helps pay for. And there's more nuances to it, and I haven't figured out exactly all the nuances. Like you get to choose like who you donate to, and there's some kind of like community aspect to it that I'm quite interested in seeing what the inside of it looks like. It also actually covers an annual dentist exam and vision exam, and $175 per person is pretty reasonable, like considering what normal premiums are. And there's no $7,000 deductible. And it actually also does cover like functional doctors and I'm not sure if this is right, physiotherapy, but it actually does cover like quite a bit. And the event is not only like the first, like if you break a leg or something, it's not just like the going to the emergency room, it's actually covering the entire health event to heal. So it covers all of the subsequent appointments for whatever follow-ups are needed. So it's like $500 per health event. So it's looking like we might be signing up for CrowdHealth, which is kind of like bringing this like fresh breath of air into my heart of feeling just like this doom and gloom around American health insurance and just the limited capitalistic, like no, like not actually healthcare. Which brings me to like another piece of this puzzle for me that I'd like to share with you guys is Tony Robbins came out with this new book called Life Force, which I listened to earlier this year. And he talked a lot about this concept between sick care and health care. And he talks a lot about like how our current health insurance is sick care. A lot of what I just said in the beginning of the podcast or in the beginning of this. And he says, he has this like Fountain Life health program that he has created that has incredible, like extensive, like preventative testing, like full body MRIs, like scanning for cancers, like at the early stages, and really like looking at the genome and the genetics and really doing thorough blood work to really look at what's going on in your body and what can you do now before you're sick to prevent getting sick. And this is where my heart is, and this is what my coaching program is built on. I mean, I do work with people who have symptoms and who making the changes, lifestyle, diet, stress changes, like actually does miraculously heal symptoms, because when we actually like live in alignment and our body can like actually heal itself, it will do that. But truly like living in a way that we can actually prevent disease. It's powerful. And it's my life's mission is to help other people understand how health is actually really quite simple and it's doable and it's way more accessible than most of us believe it is. It's not so mysterious. It's not so confusing. It's taking care of our body and our mind and our stress levels and investing in the lifestyle habits that serve us, that don't just feel good in the moment. And all of these little tiny changes, all these little tiny steps, they add up to like actually living healthy. So anyway, I'm pretty darn excited about finding it's not really health insurance. In fact, CrowdHealth is like really explicitly said, we are not health insurance. We are not health insurance. So I'm actually kind of at a loss for words of like, what are they actually? They are health coverage. They're health reassurance. I don't know. Actually, maybe I'll look at their website again and see what their words are. But like actually finding an option that fits our lifestyle and that fits our health needs. And so I wanted to share it with you. And yeah, it's one of our big pieces we've been trying to figure out along the way of moving here and living in the US. And yeah, health insurance. It's a big, I will probably do another another video on this topic and give you guys more of the actual experience once I've been working with CrowdHealth for a while. But it's a breath of fresh air. I actually woke up in the middle of the night and I was like, it almost seems too good to be true. And so I did a bunch more research today. I'm like, is this too good to be true? And asked a bunch more questions with a representative that I've been working with, John, and he's been helping answer a lot of the questions. It might be a really promising option. So that is this week's video: health insurance, sick care versus healthcare, CrowdHealth, and settling down and living in Reno, USA. Thank you for your time and attention. I hope this is helpful. Go check them out. They have an option of an affiliate link. So I will, when I get that affiliate link, I'll put that below here. I know that they have some great discounts for affiliate links, and that'd be great if you use it. And I think it might be something that I start promoting if it works. And yeah, to your health and well-being, and to living a healthy, meaningful life. All right. I wish you all the best, and I'll see you next time. Thank you.